Today's virtual lesson is on blood. First, let's review some of the cellular components that were covered in the Blackboard Learning module. Please make note of the red highlighted areas. This is what you'll be responsible for the exam. So you don't have to worry about the description of the different types of blood cells or the numbers present. I'll just give you a real quick tip to remember the prevalence of the typical white blood cells within a normal range. And this is just because this is not particularly a physiology class, so it's human anatomy, and we just really don't have time to delve into all this information. Okay, but what you should have covered previously, red blood cells or erythrocytes, they transport oxygen as well as carbon dioxide. And the general function for white blood cells or leukocytes is they help to destroy pathogenic microorganisms. This could be bacteria, this could be viruses, parasites. They also help to remove any like worn out cells that have died, and I would say need to have their bodies removed. Make sure you understand that there are two categories of white blood cells. There's granulocytes and agranulocytes. The granulocytes are neutrophil, eosinophil, or basophil. I call them the Phil brothers. I don't know, that's how I look at it, right? So they're all granulocytes. And then the monocytes or the lymphocytes are agranulocytes. The prefix A or AN means without or absence, right? So the neutrophil, eosinophil, basophil have granules. And then what we're just going to focus on is the function. So neutrophils phagocytize, which means engulfs and destroys small particles. So this can be bacteria, other foreign substances. Eosinophils predominantly are involved in allergic reactions. Yeah, they're my least favorite of all the granulocytes. Also, parasitic infections. The basophils release heparin, which helps prevent blood clotting, and histamine, which is a vasodilator. So that is involved with increasing blood flow to an area where there is an immune response. Though histamine, right, can cause, increased blood flow, can increase pressure in an area, and this is what causes stuffiness, right, especially in the springtime, and then you take a histamine, right? The agranulocytes, you have monocytes, you have lymphocytes. There's actually a variety of types of lymphocytes. We're just doing a very general overview. Monocytes also phagocytize, engulf, destroy large particles. And the lymphocytes, so there's T cells and B cells, and the B cells produce antibodies. The T cells kind of act as like the general of the immune system. So just know they in general oversee immunity. And then today we're going to talk about blood clotting, and that's a function of platelets or thrombocytes. And they're just a cellular fragment. So that's highlighted in red. They're cellular fragment of a megakaryocyte. Don't have to worry about that name. But they're very, very tiny, and they help control blood loss. All right. The never let your monkeys eat bananas is a way to just quickly remember the prevalence of the white blood cells. So never, N for neutrophil, L for lymphocyte, M for monocyte, E for eosinophil, and B for basophil. So it's just a quick way to remember the prevalence of the white blood cells. So if somebody has an elevated like eosinophil count, right, that could indicate that they are undergoing a severe allergic reaction. So when the percentages shift, that can also be used diagnostically. So hemostasis, make sure you know the term hemostasis. So hemato means blood. Stasis means stop, right? So it means the stoppage of bleeding, and it's a 3-stage process that's used to hopefully slow down, prevent blood loss, depends on how big your injury is. The first stage is the vascular spasm, which is also called a vasospasm. So vaso is the word part for vessel. Then a platelet plug forms, and then the most efficient way of preventing blood loss is through blood coagulation. All right, so this is what happens initially. You have a vascular spasm. So you have a cut, you injure a small blood vessel, and this injury causes the walls within the blood vessel to contract, and this is called a vascular spasm or vasospasm. So this is intended to immediately start to restrict blood loss. It's a reflex initiated by pain receptors detecting an injury. It lasts only a few minutes, but its effects can be effective for about 30 minutes, which, your body is giving time for the platelet plug, and blood coagulation to then occur. Right? So after 30 minutes, these other processes are well underway. The blood vessel also starts to constrict, and that is intended to decrease blood loss at the site of an injury. So the platelets or thrombocytes normally are just flowing through your bloodstream, but they will tend to stick to rough surfaces. And this would be especially the collagen of connective tissue. So when you have an injury, right, you've cut through the endothelial tissue that lines the inside of the blood vessel. So you've now exposed the underlying collagen. And so the platelets are going to stick to this underlying collagen. And they become, I always think they start to hold hands. I know it's weird, but they become very spiny and they kind of start to attach to each other. And then they form a plug, right? So they stick together and they form a plug at the site of the vascular injury. And this is very effective on small blood vessels. So this might be enough to stop vascular injury. This is just showing steps in platelet plug formation. So you have a break in the vessel wall, right? The blood starts escaping. So the platelets are going to start escaping, but when they reach this exposed collagen, that causes them to kind of become spiny and start to stick to each other. The most effective means of hemostasis is blood coagulation. And this is a complex series of chemical reactions, which I'll show you, but we're not going to really be responsible for all the detail, that results in the formation of a blood clot. So this is something that the body needs to be able to occur very quickly, but you don't want it happening if it's not necessary. So I don't know, I think of it as like you kind of have like all the army soldiers ready, right? And then they get, like the, start signal, and then they all have different jobs. So there's many clotting factors that contribute to blood coagulation, and they're all in place and in your blood, but many of them are inactivated until like that signal starts. So the finalized result is there's a blood plasma protein that's called fibrinogen, and it's activated into fibrin. And fibrin is a protein thread that kind of reinforces, it's like a mesh net that reinforces the trapped blood vessels and platelets, and this forms a blood clot. So this is a diagram from our book, and then I'll show you like the real diagram of hemostasis. But you said you have tissue damage, blood vessel spasm, kind of, temporary, really quick response. The plug forms, the plug is then reinforced by the clotting mechanism, right? Don't worry about thrombin activator. That would be like a clotting factor. This requires calcium. And then just the part we're looking at is fibrinogen is an activated to fibrin, right? So again, don't want the clot to form when it shouldn't, but you need fibrinogen present in your bloodstream at all times so that the fibrin can form. Here's the real reaction. Oh yeah, it's going crazy, okay? And so all this means, and you don't need to know the names of the pathways for the test, but it's a little bit interesting. There's kind of like plan A, plan B. So there's the intrinsic coagulation pathway, which is triggered by internal damage. So this refers to factors that are, activated within the blood. And then there's kind of like the backup plan, the intrinsic coagulation pathway, and this is factors released outside the blood. So these are tissue factors that are released. But you can see, I know they started naming them Roman numerally, and then they realized that the order was different. So that's why they don't nicely go from like 1 to 12 or whatever. Okay, but both pathways are going to get you to the fibrinogen to fibrin to form the fibrin threads. So people that are hemophiliac is that they have a genetic abnormality where they're missing one of the clotting factors. And there's several types of hemophilia. Okay, so in the case of any type of injury, they need to inject clotting factor into their bloodstream to have blood coagulation occur. This is just showing the fibrin threads. That's like the orange strands, and it's showing how it's entrapping red blood cells, which are much bigger than platelets. The platelets are also in there as well, just not particularly obvious. Sometimes blood clots form abnormally. They form when they shouldn't. And so if a blood clot forms abnormally in a blood vessel, it's called a thrombus. So it's something you might have heard of, deep vein thrombosis, which the deep veins of the legs where the blood is not under an enormous amount of pressure, and particularly if an individual, I always hear about this, people on very long plane rides where you're sitting still, but blood pools in these deep veins of your legs. And, you have all the clotting factors there. They're normally, again, kind of just going through the bloodstream. If some of the platelets start to aggregate, it can sometimes trigger the formation of a clot when it's undesirable. Now, if this breaks off and travels through your bloodstream, it's then known as an embolus. An embolus is just like a thrombus that's on the move. And there's also different types of embolus. It really just means an abnormal kind of structure moving through the bloodstream. You could have like a fatty embolus. You can even have air. Air can act as an embolus. Okay, but in the case of the blood clots, it can travel through the blood, and this can be very serious, and it can actually be fatal. So a coronary thrombosis, this is where you have a clot in a vessel that supplies the heart, right, the myocardium. There's a pulmonary embolism. That's where you have a traveling blood clot. It's formed in some other part of the body. For instance, it could be like a deep vein in the leg. It breaks off and blocks part of the lung. That can cause death. If the coronary thrombosis moves, right, the clot can then totally block blood flow, and then that restricts blood to the tissues on the other side of the clot, and that can lead to a myocardial infarction, which is a heart attack. So an infarction is just restriction of blood flow to a structure. Myocardial means you're restricting blood flow to the heart. Now, individuals that have atherosclerosis, so this is the hardening of the arteries, with yellowish fatty plaque. The buildup of this fatty material and the walls of the arteries can sometimes cause the platelets to adhere and form an abnormal clot. So remember, they're like swimming along freely, right? They're not sticking to the walls of the blood vessels because the walls of your blood vessels are nice or smooth, and they're triggered, this reaction is triggered by the platelets adhering together on collagen, right? So if you have fatty deposits, that can sometimes trigger clot formation also. So picture A is showing a normal artery. The lumen is just the opening in the middle, right? So the lumen is nice and wide. In picture B, you can see how blood flow is being restricted because the opening is much smaller. And now where you have plaque buildup all around the inside of the artery, this is no longer provides that nice smooth surface. So there is a chance that, right, the platelets could start to aggregate or adhere right there. Our next section is on blood typing and blood groups. So the key for this is that if you are receiving blood, if you are a recipient of a blood transfusion, the donor must be screened for compatibility. So there are 32 known red blood cell antigens. Only a few can produce a transfusion reaction, and this is the ABO group. Okay, also including Rh factor. So these need to be the same between the donor and recipient. If at all possible, there are some blood types that can readily donate to everyone, but ideally, if you're A positive, you receive A positive blood. All right, some important definitions. So an antigen is a unique marker that's found on the surface of your cells, right? You have self-antigens that should not cause an immune response, but if your body comes in contact with a foreign antigen, then this will invoke an immune response, right? So these are proteins, these are carbohydrates, they're found on the surface of all your cells. Right, you've probably heard, oh, like if somebody needs a kidney transplant, it has to be a closed match, so it's not rejected. Okay, so foreign antigens will trigger an immune response. All right, so what an antibody is, right, and antibodies are produced by your lymphocytes, but these are proteins that attack a specific antigen. So it's like, I don't know, it's like one-on-one combat. And an antibody is only specific to one antigen. Now, when a baby is born, right, initially these antibodies are not present, but they are genetically determined, and after a few months of birth, you will have antibodies in your body to foreign red blood cell antigens, right? So if I have type A blood and I get, and we'll go through all of these in detail, and I get a transfusion of type B blood, the B antigen is foreign to me, my antibodies will, what they're trying to do is they're trying to pull together all the foreign cells because they have these foreign antigens. And this process is called agglutination, not to be confused with coagulation. Coagulation is formation of a blood clot. Agglutination is when foreign red blood cells become pulled together, right? And then these red blood cells are going to break open in lyse, right? And this can cause, so on the bottom of the slide says lysis or breakdown of red blood cells. This can cause hemoglobin release. Free hemoglobin is it's great inside your red blood cells. It's not great outside. It can cause kidney failure. It can affect the liver. It can cause breathing problems and pain, and it can cause death. So if you get an incompatible transfusion, this can cause death. Okay, let me just go back up to the next statement. When you get a transfusion, right, the antibodies in you, the recipient's plasma, are going to agglutinate foreign antigens on the surface of the donor's red blood cells. All right, so the ABO blood groups are based on the presence of two of these. This is the important antigens in giving blood transfusions, and they're found on red blood cells. All right, starting alphabetically, they just decided to name them A and B. Okay, so these are inherited. You inherit your blood type from your parents. If you're type A, that means you have A antigens on your red blood cell membranes. And so B would be a foreign antigen to you, and so you have anti-B antibodies. Or I like to say antibodies to B. Right, so you have anti-B antibodies. People that have B blood, right, A blood would be foreign to them because they have anti-A antibodies. So without getting crazy with the genetics, this is also a case of codominance because individuals, right, can be AB, which means they have both types of antigens on their red blood cells, right? So remember, you're never going to have antibodies to an antigen that you possess. So people that are AB don't have either type of antibodies being produced and found in their plasma. There are also individuals that are type O, and I think of it as 0, but it means that they have neither, right? You still have antigens, you just don't have A, you just don't have B, and so you would sense A blood, B blood, okay, as well as AB blood is being foreign because you have both types of antibodies in your plasma. Right, so this is just kind of giving us like a picture, right, of what it would look like. So you see antigen A, they're little like orange circles. This person has type A blood. They're going to have type B antibodies going across the top. If you have type B blood, you're going to have type A antibodies. Just remember, you can have antibodies to what you have antigens of or you as self-agglutinate. Okay? AB blood, so they have the orange circles and the green triangles. They don't have either antibody. Type O blood doesn't have either antigen, but they have both antibodies. So, all right, this is a little confusing. Antibodies of one type will react with antigens of the same type. Okay, so remember, your antibodies are produced to the foreign antigens, right? And so this is going to cause agglutination. All right, so the main concern is possible agglutination of the donor's red blood cells. I'm type A minus, if I got type B blood, by the antibodies in my recipient's plasma. All right, so all right, if this doesn't make sense, you're fine. Okay, let me read the next statement. All right, if I have type A blood, that my antigens are A, I have anti-B antibodies in my plasma, you could not give me type B blood. All right, here's to where it gets. So this chart, which is in your packet, shows possible blood types for transfusions. So if you have type A blood, remember you have type B antibodies. If you have B blood, you have A antibodies. If you have AB blood, you don't have either antibodies. And if you're O, you don't have either of the antigens, but you have both of the antibodies. This slide is just showing normal blood and what blood looks like when it's agglutinated. And I know it almost looks like a clot, but there aren't platelets involved. There's not fiber threads that are involved. And what's going to happen is these agglutinated red blood cells, they are going to break down, they're going to lyse, they're going to clog blood vessels, and free hemoglobin can be toxic. All right, so people that have type AB blood, right, don't have either of the antibodies in their system, and so they're called the universal recipient, right? So in theory, they could receive any of the blood types because they don't have any anti-A or anti-B antibodies. So they can receive blood from any of the other blood types. People that are type O, because their red blood cells do not contain either of the antigens, they can be transfused into individuals with any of the 4 blood types, right? Since their red blood cells will be not attacked by blood antibodies, right? So now gets like a little more complicated. If this doesn't quite make sense, you can ask me about it. You don't have to worry about it for the test. When you're given a blood transfusion, you're given packed cells, okay? But within these packed cells, so I'm type A, right? If you gave me type O blood, right? It doesn't have antigens, doesn't have any antigens for my antibodies to attack. But remember, people that are type O have both antibodies. So I may be receiving a very small amount of antibodies that might target my red blood cells. However, this is very minimal, but for this reason, when given a blood transfusion, they try to give you your type. Unless it's some type of medical emergency and your blood type is not available, then they would go with O. So I'm going to post a link underneath this lecture to the Nobel Prize blood typing game. And if you look at tutorial 2, how to determine a patient's blood type, I find it entertaining, specifically if you give the person the wrong blood type. But it just would kind of give you a practice on how transfusions are done. All right, so here where it gets, I don't want to say a little bit more complicated, slightly more complicated, how's that? We're going to run into this on the next slide, but there is an additional factor that is called the Rh factor, or sometimes antigen D, that either you have it or you don't. If you don't have antigen D, you're Rh negative. And if you do have antigen D, you're Rh positive. Okay, so this is showing all the different blood types, and obviously what your preferred blood type of donor would be exactly the same blood type, the same Rh factor, but on the next slide, it shows possible blood types of donors. So you can give, because it is an antigen, right, you can give Rh negative blood to Rh positive people, but Rh negative people can only receive Rh negative blood. So often called the Rh blood group, it was first discovered in rhesus monkeys. Okay, it's the most common antigen of this group. And again, there's a lot of antigens. There's just a few that are really essential to prevent a transfusion reaction. So it's antigen D. And if you have antigen D, you're Rh positive. If you don't have antigen D, you're Rh negative. Okay, now the reason why this one's a little bit different is you don't have corresponding antibodies in the plasma, right? If you're Rh negative, unless you come in contact with Rh negative blood. So this is a type of immunity that's not innate, you're not born with, but it's acquired. So it's similar to if you had the measles, you typically don't contract the measles again because you have antibodies to the measles. So you don't have any antibodies to the Rh factor unless you come in contact with Rh positive blood. Now, this could occur during a transfusion. Go to the next slide. Right, this can occur during a transfusion, or it also occurs during pregnancy. Okay, so we really don't go to this in this course in detail, but everybody thinks, okay, the umbilical cord is connected directly to the mother's circulation. It's actually an area where two sets of blood vessels, I always think of them like you have a lake. This is weird. You have a lake, and on the bank of each side of the lake, you have the maternal circulation, and then you have like the fetal circulation, and then there's a pool of blood in the middle where substances can flow in both directions. Okay, the antibodies for A and B do not pass from maternal to fetal circulation, but the antibodies to the Rh factor, because that's acquired, can. This is similar to babies when they're born. They have some immunity due to antibodies that have passed from the maternal circulation into the fetal circulation. Okay, so where this becomes significant is you have an Rh negative woman and carries an Rh positive baby. During birth, that's when there's often a true mixing of maternal and fetal blood. The mother may be exposed to Rh positive blood during delivery. She will then make Rh antibodies, which could go from maternal circulation into the fetal circulation, right, of a future Rh positive baby, and this can cause the breakdown of the fetus's red blood cells. So this is called erythroblastosis, abnormal conditioning, erythro, red blood cell. Blast means like developing, and then fetalis of fetus, right? Or hemolytic, so hematos blood, lysis means breakdown, right? So whether it's a breakdown or destruction of developing fetal cells, and these children can be born very anemic because their red blood cells have been broken down. This problem can be solved by giving the mother the drug, okay, it's not on there, but it's called RhoGAM, capital R, H-O, capital G-A-M, and this is a blood that just prevents the production of Rh antibodies. So an Rh mother, maybe, you can't say for certain you've never been exposed to Rh positive blood, right? So what you do, like halfway through the pregnancy and then upon birth, you just get an injection of this medication that prevents the production of Rh antibodies. Right, so this is showing Rh negative female, Rh positive fetus, right, during childbirth. Some of the cells from the fetus may enter into the mother's circulation, right? You then become sensitized to it, and then now you have these antibodies that could, right, be, could cross the placental barrier and affect the fetus. And then the ROGAM just eliminates. Those are antibodies like as Ys, because they're pulling cells together. That then eliminates production of these antibodies. Yes, to our Greek and Latin word parts. Erythro, meaning red. Now I mentioned another one, don't worry about it. Hema, hemo, hemato. Right? These all are word roots for blood. Luke, white. Osis. So osis means abnormal condition, like I think we like cyanosis, somebody's skin's like turning blue. When used with erythro, leuko, thrombo, it means an abnormal increase. An abnormal increase. Poesis means like formation, to make or produce. Stasis we did before, like we did hemostasis, metastasis, means like stop or standing still. So metastasis, meta, remember meta went beyond, it was like beyond standing still. Thromb means clot. Here's our terms. All right, so red blood cell. Make sure you pause, think of these first before you go ahead. Erythrocyte, so yeah, the word blood is not in there, so it's not like, you know, hemoerythrocyte, so it just means red cell, but it refers to red blood cell. Stoppage of bleeding. Hemostasis. A blood cell clot. Platelets or thrombocytes. It also means like clot cell, clot blood cell. Yeah, clot blood cell. If you have an elevated white blood cell count, which could indicates an infection, that would be a leukocytosis. And formation of, sorry, that was already there. Formation of red blood cells, erythropoiesis. So we've finished everything in Unit 2. Okay, so there's a review sheet that's posted on Blackboard, right? There's the snow day video. There's the 2 Blackboard learning modules. I wanted to move the test. It would be not next week, the week after. Make sure you go through the packet, you fill in the information, you come armed with plenty of questions for next week, right? Once we're done reviewing, I don't think it'll take the entire class, we will then start on Unit 3, which is on the nervous system, which will also be beginning in lab on Thursday. So Thursday in lab, remind me, to give you your Unit 3 lecture notes, so that way if you are virtual, you'll have a hard copy of the packet. Yes, today at 1:30, I'm off to see a clean room. I'm part of our workforce development program to train basically like high school graduates or individuals that are kind of looking for a career change without going through like an entire associate's degree to work in a clean room. I'm very excited because they asked me for my shoe size. Now, I don't think they're going to actually let us go into a clean room because we don't have the training ourselves, but I think we'll get fairly close to a clean room. So I will be able to report back on Thursday whether I suffered from severe claustrophobia or any other issues that occurred. Okay, see you Thursday.